In today's Health Watch, Local 3's Caitlin Corbett has some simple tips that could save lives.
Do you recognize the signs of cardiac arrest? And do you know what to do if you see them? Aurora BayCare Medical Center is making sure folks know how to spot those signs and how to administer life-saving measures when they do.
The initiative, at least for us locally, is we want to have more people, enable more people to save lives.
Dr. Carrie Ahrens is an emergency medicine physician at Aurora BayCare, and this Heart Month, she wants to make sure people can recognize a potential killer, cardiac arrest. But more than that, Dr. Ahrens wants to make sure people have the tools to save a life through compress and shock training.
It kind of empowers people to actually attempt to save someone's life. And that starts right there when someone collapses. You just start pushing on their chest. And if they push you off, you're done. They're fine. If they don't push you off, you keep going until help arrives.
While the goal is to have everyone trained on CPR and AED use, the compress method is less intimidating. It prioritizes pushing on the chest immediately and continuously without having to worry about stopping to administer breaths periodically as in traditional CPR.
This is so much better than doing nothing. And so the breathing is secondary. It's still necessary, but secondary early on when someone collapses.
Getting more AED devices into the community and training more people on how to use them is also part of the goal. During cardiac arrest, it's usually an electrical disturbance that causes the heart to stop beating. Using an AED restores that normal rhythm to the heart.
Generally, when a person collapses in front of you, doing compressions is just half of the goal. The second half is getting that electrical system restarted, because much of the time that's what needs to happen. And if the heart can pump all by itself, that person has a much better chance of having a meaningful survival than if someone's pumping it for them.
Marie Wedipole and Louisa Keenan are medical students at UW-Madison and receiving tutelage at Aurora BayCare. They taught compress and shock as their community health project, knowing it has significant importance in more rural communities where it may take longer for help to arrive.
We know how long the wait times for EMS services or just the transportation from EMS services to hospitals can be. And so we wanted to positively impact the community by teaching a group of community members how to perform CPR and use an AED to help kind of take matters into their own hands in emergency services.
Time is precious in an incident of cardiac arrest, but having the proper tools and taking immediate action can save lives.
CPR is a skill that's very easy to learn, and it's something that anyone can do. I think that it's so important that you talk to your friends and your family about learning CPR and also just continuing to practice it as a skill.
Taking a heart risk assessment can help you be proactive. To learn how you can take one, visit Aurora BayCare's website. And that's your Health Watch. I'm Caitlin Corbett for Local 3 News.